Today, we're going to be talking about a topic that affects so many individuals, hormonal imbalance, and how to treat it in order to get pregnant. I'll be explaining what hormones are, what hormonal imbalance is, how to know when you have hormonal imbalance, and how they affect a woman's ability to get pregnant. Most importantly, how to treat it in order to get pregnant. So if you're new to my channel, I am Dr. Amarachi Ijeoma. I am a fertility physician and my channel focuses on everything infertility and women's health. So if this is the kind of content you're interested in, keep watching. Before we jump into the solution, let's first understand what hormonal imbalance is. Hormones are chemicals that regulate the system of our bodies. They control our bodies by sending messages through our blood to our organs, muscles, and other tissues in our bodies. And there are lots of hormones in our bodies for different functions. So hormonal imbalance is simply when our bodies produces either too much or too little of a particular hormone. And this imbalance not only affects women, it also affects men, and it causes a range of symptoms, both emotional and physical symptoms in our bodies. So there are hormones that control the function of our reproductive system, that is our fertility hormones. And these hormones control a woman's ability to get pregnant. And these hormones are produced both in our brains and in our ovaries, and they need to communicate every month in order for us to see our periods. This communication also helps us to ovulate, that is, it helps our ovaries to release a mature egg, and it also prepares our womb, our uterus, to receive a baby. So if you have regular periods, that is, you see your periods every 21 to 35 days, then your hormone is balanced. But if you see your periods less than 21 days apart or greater than 35 days apart, then your hormones are imbalanced. That is, you're experiencing hormonal imbalance. Does this make sense now? If you're still trying to understand it, it's okay. Just rewind, you'll get it. So one of the hormones is called FSH, follicle stimulating hormone. This hormone is important because it helps to produce the eggs and it helps for these eggs to be mature. It helps to develop the eggs by causing the sac of fluids that contains the egg at the beginning of your menstrual cycle to grow every month. So this sac of fluid that contains the egg is called a follicle. So as this follicle is growing, it releases another hormone called estrogen and a smaller amount of another hormone called progesterone. The estrogen then causes the lining of your womb, the lining of your uterus to thicken so that it prepares like for an embryo to come and attach. So once this follicle is big enough to release the mature egg, it causes another hormone called LH to rise suddenly. And the sudden rise in this LH hormone causes the follicle to rupture, causes it to burst and release the mature egg into the fallopian tube. It is only after this egg has been released into the fallopian tube that the sperm can come to fertilize it. Then the fertilized egg will then travel for about 5 to 6 days into the uterus and then attach on the wall of the uterus. So this attachment is called implantation. So remember that sac of fluid that bursts to release the mature egg? The remnants will now cause the rise of another hormone called progesterone. It is now this progesterone that will help to support the pregnancy. So this is how beautiful the communication between your brain and your ovaries work in order for you to get pregnant. So if any of these hormones are too high or too low, it can lead to miscommunication. And this miscommunication will prevent the follicles from growing, it will prevent mature egg from being released from the ovary, it will prevent fertilization from occurring, and hence preventing pregnancy from occurring. And even when pregnancy occurs, if the hormone that is supposed to support pregnancy is low, it can lead to a miscarriage. So how do you know you have hormonal imbalance? First, you need to know your cycle length. Cycle length is the number of days in between your periods, counting from the very first day that you see your period to the last day before you see your next period. And the normal cycle length is between 21 to 35 days. So if you see your periods less than 21 days apart or greater than 35 days apart, then you have irregular periods. And irregular periods is as a result of hormonal imbalance. And you can confirm this by doing some blood tests called FSH, LH, and estrogen. And these three tests are done between your day 2 and day 5 of your menstrual cycle. So LH is luteinizing hormone, FSH is follicle stimulating hormone, and estrogen is estrogen. Progesterone is also a blood test, and this blood test is usually done 7 days before your next period. I know some of you have probably heard you do progesterone on day 21. Well, this is true and not true. So the average cycle length for a woman is 28 days. So 7 days to the next period of a 28-day cycle is day 21. What if your cycle length is not 28 days? You see what I did there? So if you have a cycle length of 34 days, you do it 7 days to your next period. And 7 days to your next period of a 34-day cycle length is not day 21. So for a woman with a 34-day cycle, it will be done on day 27. That is the simple calculation. If your cycle length is greater than 35 days, that is any number greater than 35 days, whether it's 45 days, 42 days, 80 days, 90 days. For some women, it takes about 80 days before they see their next period. And you also have symptoms of increased male hormones like excessive hair on your chin, chest, body, face, everywhere, even your lower abdomen, or you have excessive acne that is difficult to treat, and then you do an ultrasound scan, and then we see numerous tiny follicles, that's sacs of fluid, tiny, round the edges of your ovary. You don't necessarily have to have these 3 symptoms. You only need 2 out of these 3 symptoms. Then the diagnosis may be PCOS. Now, PCOS is simply polycystic ovarian syndrome. PCOS is the commonest cause of hormonal imbalance in women, and it impacts fertility negatively because it reduces the chances of ovulation. So this doesn't mean that if you have PCOS, you cannot get pregnant. It just means that it reduces the chances because you don't have as many ovulations as another woman that does not have PCOS. So one of the most effective ways to address PCOS, to address hormonal imbalance, is lifestyle modification. So when you make healthy choices, it can significantly impact positively on your hormone levels. If you're overweight, lose some weight because fat cells make estrogen. Estrogen is a type of estrogen. So when you lose the fat, estrogen is released, and this estrogen will help your PCOS. Because in PCOS, the ovaries are not making enough estrogen. So the estrogen gotten from the fat cells helps to give the ovaries the estrogen that it needs. So you can lose weight by eating a balanced diet. Focus on consuming a well-rounded diet rich in fresh fruits, vegetables, lean protein, healthy fats, and whole grains. Avoid processed foods, refined sugars, and excessive caffeine. Engage in regular physical activity to promote hormone regulation. Exercise also helps to improve your overall well-being. Find activities you enjoy such as walking, jogging, running, swimming, and even yoga, and aim for at least 30 minutes most days of the week. Another lifestyle change can be stress management. Chronic stress can disrupt hormonal balance. Explore stress reduction techniques like meditation, deep breathing exercises, journaling, or engaging in hobbies that help you relax and unwind. Certain supplements have been used to support hormonal balance. For example, omega-3 fatty acids. And you can find this in fatty fish, flax seeds, and walnuts. Omega-3 fatty acids can help to reduce inflammation and support hormone production. Even though lifestyle modification can be very helpful when you're trying to balance your hormones, remember that hormonal imbalance can be a little complex for some people. For some people, it's not just a straightforward thing. You need to get evaluated by your doctor. You need to get adequate counseling that is tailored to just you. So if you have tried everything that I've mentioned in this video, or you're just about to try, The most important thing is to try, and after you have tried these methods and you're still finding it hard to conceive, you should see your fertility specialist for adequate evaluation and counseling tailored to you. Your fertility specialist may place you on a drug called Clomid or letrozole if you are actively trying to get pregnant. So usually what these drugs do is that it helps you to ovulate. That's like the general thing that they do. They help you to ovulate, and that is they help your ovaries to release a mature egg in order for a sperm to be able to fertilize it and pregnancy to occur. Remember, treating hormonal imbalance takes time, so you have to be patient, enjoy the journey, have a positive mindset, and be hopeful. It's a journey of self-care and finding what works best for your body. If you found this video informative and you want more content like this, like this video, share with your friends, drop a comment below, and see you in my next video.